Okay, guys. So, good day. So, for this discussion, it will be about Administrative Order number 2007 0027. So, it is about the revised rules and regulations governing the licensure and regulation of clinical laboratories in the Philippines. So, at the end of the discussion, students must be able to define terms related to this law, explain the concepts of laws with emphasis in the use of clinical laboratory, and appreciate all the concepts and rationale related to this law. So this law, guys, is about clinical laboratories. Okay, so how should they be regulated? What are the regulations? Ano yung mga rules? Okay, so for the rationale, um So if you remember, physicians utilize clinical laboratories or the laboratory results from clinical laboratories to aid in their diagnosis or management of patients. Therefore, accurate or reliable test results must be given, okay, for them to be able to give reliable diagnosis as well as management. So with this, there was the RA number 4688 series of 1966, which was made to ensure and improve the quality of patient care. Okay, so this is about the operation and maintenance of clinical laboratories, wherein it provided penalties for the violations of the rules and regulations. So this mandated the DOH to look after the public welfare by effectively enforcing and updating the current regulations to improve laboratory performance. So clinical laboratories, why is it that regulations, rules and regulations are important in the practice of these clinical laboratories? So take note, guys, that their purpose is for public health. Okay, so since the test results um, that are from this that are made from these clinical laboratories involves patient lives or human lives, it is therefore very essential that what they do must be in accordance with the law to prevent, okay, to prevent abuse, to prevent malpractice or negligence, and to provide penalties so that negligence, malpractice, or other violations are not made. Okay? That is to protect the general welfare of the public. Okay? So, kung walang rules and regulations para sa mga clinical laboratories, pwede silang maging negligent, pagbigay ng mga test result na mali-mali. Okay? Pwede silang mag-malpractice kasi wala naman palang violations. That's why the rules and regulations are very important. Okay? So, it gives or it provides the limits. Okay? So, the objective, this is to prescribe a revised minimum standard, okay, for the practice of clinical laboratories. Aside from that, that is to ensure accuracy and precision of laboratory examination in order to safeguard public health and safety. So this is the main, okay, importance or objective of this law. Okay, accuracy and precision of test results, and so that the public health and safety is protected. Okay, so what is covered by this law? Okay, as long as a laboratory provides test results for the diagnosis or management of patient, that is under, they are under the rules and regulations of this law. Okay? So, lahat, either public man yan or private, okay? As long as they perform examinations, blah, 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 in which physicians use it in their prevention, diagnosis, and treatment and management or promotion of personal and public health, they are covered by this law. Okay? But there are exemptions. Sino yung mga exempted sa coverage ng law na to? So, exempted dito yung mga government clinical laboratories wherein they only do microscopy work for specific DOH programs but not limited to malaria screening, AFB microscopy, test for STI, and cervical cancer screening using pap smear. So, yung mga to, sorry. So, the laboratories who conduct the following tests, if they only do microscopy, this one, malaria screening, and the test that I mentioned, they are not governed by the rules and regulations of this law kasi exempted sila. Okay? So, we have here the definition of terms. So, you read. So, pag sinasabi nating applicant, yan, natural or judicial person who intend to operate, pag gusto nila mag-operate ng laboratory, Bureau of Health Facilities and Services, CHD, okay, and others. Okay, si EQUAP guys, so this is an acronym for External Quality Assessment Program wherein reference laboratories send a sample to the different laboratories to test, okay, for them to test. So, ite-test yan ng mga different clinical laboratories and the results will be compared to the test result of the reference lab. Kumbaga, this is made for quality assurance to check if what the clinical laboratories are doing is that are they accurate? They give accurate or precise results. Okay. Pag POL, Physician's Office Laboratory, pag sinasabi natin stat test, this one stands for, this is actually from the word statin. Okay. So, yun, it's here, which means immediately. Dapat agad-agad siyang matest. That is within 1 hour. So, ano yung mga test that must be done within 1 hour? Example is the troponin test in the case of heart attack, okay, or acute myocardial infarction. Kapag feeling ng nasa ER, may heart attack na nangyari, or acute myocardial infarction, they can request for troponin test to determine or to establish the diagnosis. Okay, we have here the different classification. Okay, so it's easy to understand naman if that is ownership, government, or private. Pag sinabi natin government, clinical laboratories, these are laboratories within the hospitals by the government like CBMC or people's, mga ganyan. So, as long as that is owned by the government, okay, or that is what do you call this one? The budget comes from the government, so that is government owned. Okay, yung mga district hospital, mga provincial hospital, mga rural health unit na may laboratory, those are governmentally owned. Pag private naman, of course, it is by individuals or corporations like si St. Luke's, St. Paul, Holy Infant, okay? So, Divine Mercy, so those are privately owned. Pag by function naman, clinical pathology, we have here clinical pathology and anatomic pathology. Pag under clinical pathology, and under dyan yung clinical chemistry, hema, and others. So, sa anatomic naman, kasama si surgical pathology, immunohistopathology, cytology, autopsy, forensic, and molecular pathology. Pag institutional character, institution-based, and freestanding. When we say institution-based, the clinical laboratory is within an institution. Nasa loob siya ng hospital, mga ganyan, or nasa loob ng RHU, okay, nasa loob ng clinic, nasa loob ng university. Those are institution-based. Kapag freestanding siya, okay, hindi siya under ng institution, nag-i-exist lang siya as a laboratory. Okay, so in NCR areas, there are many clinical laboratories. What they do is that they only test specimens. Okay? Clinical laboratory lang siya. Hindi siya parte ng isang hospital, hindi siya parte ng isang company or institution. Pag service capability naman, we have here general clinical laboratory, we have primary, secondary, and tertiary. Okay guys, take note. Okay, this is very important. When we say primary category, it provides the following minimum service capabilities. Lahat ng test na to, these are conducted, these are done, or these are service capabilities ng primary category, which means all of these tests, they can offer, okay, all of these tests. Okay, a primary category laboratory can do hematocrit test, WBC test, complete blood count, qualitative platelet determination, routine analysis, routine fecalysis, okay? But if that is hospital-based, it can conduct blood typing. But kung hindi siya hospital-based, okay, if that is freestanding laboratory, that is not within the premises of a hospital, it cannot offer blood typing. Okay, another important information about this one for you to remember, okay, that you should remember is that when we say secondary category, it provides the minimum service capabilities ng primary but including the following. Okay? Nagets ba? Kapag secondary, ino-offer din niya to lahat. Kaya niyang i-offer to lahat. Pwede niyang i-offer to lahat yung mga service capabilities ng primary. But in addition to this, it offers also the following: routine clinical chemistry, quantitative platelet determination. Kasi sa primary, ang kaya lang niya is qualitative, di ba? But for secondary, it can do both qualitative and quantitative platelet determination. If the laboratory is hospital-based, it can also do cross-matching. What do you mean by cross-matching? Okay? So, i-cross-match yung sa donor's blood, sa recipient's blood to see whether they are compatible or not. If the receiver, if the blood of the donor matches with that of the receiver, if the receiver can receive that blood. Kasi hindi pwedeng magbibigay ka ng dugo, okay, na walang test kung pwede ba sila, kung compatible ba sila or not. Okay? Pag gram staining, for secondary category, if that is also hospital-based, and KOH, potassium hydroxide screening pag hospital-based. So, etong tatlo, so these are offered by secondary category only if they are hospital-based. Okay? So, again, a secondary category can offer the following services, all of this one, plus the service capabilities of primary category. Okay, in the other hand, a tertiary category provides the minimum service capabilities of a secondary laboratory plus the following. It can offer special chemistry, special hematology, including coagulation procedures. Ano yung mga coagulation procedures? Prothrombin time and activated partial thromboplasmin time, CPT at saka si APTT. Okay, so those are coagulation procedures. Immunology, okay? So, aside from that, sa microbiology, culture and sensitivity. So, yan yung nag-grow na sila ng bacteria. If aerobic and anaerobic, that can be offered only by hospital-based tertiary laboratory. Pero kapag aerobic or anaerobic or SHAHA, pwede yan sa non-hospital-based. Okay? So, kapag both aerobic and anaerobic, dapat hospital-based lang. Pero, if either aerobic or anaerobic, pwedeng non-hospital-based. So, guys, si tertiary category, it can offer all of these tests, all of the tests of the secondary category, and all of the tests offered by primary category, which means that among the three, si tertiary category yung may pinakamaraming service capabilities na test. Kasi it can offer all of the test that is offered by the secondary and primary. Huwag niyong kakalimutan yon. Okay? Please do not forget that one. Okay, so they must be, so those clinical laboratories are allowed to operate if they have the license to operate, just like for businesses, right? So businesses within our country cannot just operate without securing a business permit, right? Okay, ganun din sa mga clinical laboratory. Aside from business permit, they need to get a license to operate. Okay, so this is usually given by the DOH. Okay, another limited service capability pag mga institution-based. So, provides the laboratory test required for a particular service in institution, kagaya sa mga dialysis center and social hygiene clinics. Pag special clinical laboratory naman, laboratory that offers highly specialized lab services, usually not provided by general clinical laboratory. Usually, mga reference laboratories, mga research lab, mga ganyan. Okay, so a license to operate must be issued to clinical laboratories, and these clinical laboratories, they need to comply. So the standards and technical requirements are given or formulated by the Bureau of Health Facilities and Services, si BHFS. Okay? Pero kapag the clinical laboratory is for research and teaching purposes only, they don't need to secure licensing requirement. Okay? So, however, they are required to register. So, they are required to register with the Bureau of Health Facilities and Services, but they don't need to secure a license to operate. Pag sinasabi mga special clinical laboratories, so these are not limited to yung mga ganitong lab. So if they offer this test, these are special clinical laboratories. So if they're operating independent of a clinical laboratory, okay, what does it mean? So they offer cellular technology, forensic pathology, but they are not within the premises of clinical laboratory. Kailangan pa rin nilang mag-register sa BHFS. Okay? Wherein they do not need the license. Okay? Or I mean, they do not need to secure a license. So again, a pathologist or licensed physician trained in lab services must be the head of clinical laboratories. Paulit-ulit. So the head of clinical laboratories are physicians, especially if that is yung mga secondary or tertiary necessary na pathologist. So, when we say NRL naman, these are national reference laboratories. So, they are designated by the DOH. So, shall be covered by the license of the clinical laboratory of the hospital where they are respectively assigned. So, like for example, si RITM, yung mga ganyan, yung clinical laboratory ng East Avenue for drug testing, so those are NRL. So those are national reference laboratories. So the NRL that is physically independent from the clinical laboratory of the hospital where they are respectively assigned shall be allowed to registered only with the BHFS. So if there is a separate laboratory for the national or a national reference laboratory within the premises of a hospital, they don't need to secure a license to operate, but they need to register. Okay. Si physician's office laboratory naman, they need to secure a laboratory license when it undertakes any of the following activities. If it issue official laboratory test result, they need the license to operate. if they perform more than monitoring examination, and cater not only to the physician's own patient. So these are the conditions wherein a POL needs to secure a license to operate. So examinations performed in a POL shall only be permitted when they are used for monitoring patients. So a POCT, point of care testing conducted in a hospital, is required to be under the management and supervision of the licensed clinical laboratory of the respective hospital. Like in the cases, yung mga, when you say POCT kasi these are bedside testing. Okay, so yung mga glucometer, mga ganyan, or getting the value of the glucose beside the patient. Those are examples of POCT. So, sinasabi dito na under pa rin siya ng management and supervision ng clinical laboratory. Okay, so we move to these specific guidelines. So, every clinical laboratory shall be organized to provide quality, effective, and efficient lab services. Okay, so for the human resource, again, the laboratory head must be a pathologist. Okay? Yung head, who is the laboratory, shall have administrative and technical supervision. So, aside from that, so the head of the laboratory shall supervise the staff. Okay, so isusupervise niya dapat yung mga medtech. There shall be an adequate number ng medtech. Okay, wherein aside from the number, they should have training. Okay, as well as dapat meron silang experience to conduct lab procedures. So, yung number ng medtech, it will depend on the workload. Aside from that, there shall be staff development and continuing education. So, they need to undergo training, mga seminar, ganyan. Okay, to upgrade the knowledge, attitude, and skills of the staff. When it comes to equipment naman, there shall be available and operational equipment to provide the lab examination. Aside from that, equipment must undergo calibration to see if these are working well, are they giving accurate or reliable results. Aside from that, they must undergo preventive maintenance. Okay, and in case of breakdown, they should have a repair program. And yun nga, there should also be a contingency plan if there is an equipment breakdown. So, what happens if the laboratory cannot conduct CBC? What is the contingency plan? So, that must be indicated in the SOP. Ipapadala ba siya sa another clinical laboratory? So, dapat naka-indicate yun sa SOP. So, glasswares, reagents, and supplies, administrative policies and procedures. So, there should be policies and procedures for the provision of lab services. Okay, and for the operation and maintenance of the laboratory. So aside from that, there should be technical procedures. Okay, so sa QAP naman, Quality Assurance Program, it shall include AQCP, Internal Quality Control Program, wherein quality controls are done on a daily basis. Okay, so aside from that, for inputs, IPO, okay, IPO in Internal Quality Assurance Program. Okay, a continuous quality improvement program covering all aspects ng lab performance, and yung EQUEST nga yung sinabi ko kanina wherein they participate in the external quality assurance program. Samples are sent to these clinical laboratories and they test it. Okay, and then mako-compare yung mga test results nila from that of other clinical laboratory. Okay? So, communication and records. So, procedures for the receipt and performance of routine stat request. Okay? Aside from that, dapat meron din what is their, how should they report routine from stat lab exam, including mga critical values or yung mga reference range. Okay, aside from that, all lab reports shall have the name and signature of the pathologist. Okay, not only the pathologist but as well as the medtech who performed the exam. Excuse me. Electronic signature shall be permitted in accordance with the provisions ng e-commerce law. So, yon, there shall be procedures for reporting ng workload, quality control, inventory, as well as work schedule tsaka assignment, as well as in cases ng mga incidents, mga adverse events, may mga complaints, dapat may record din yan. And retention ng mga laboratory records in accordance with the standards made by the DOH. Like for example, yung mga laboratory test result. Okay, sa mga ganun kasi, the patient has a copy, okay, and the lab also has a copy. Minsan nilalagay pa yan sa logbook, okay? That's why we as medtech, we do not only process a specimen. Nagsusulat din tayo mga test result. Naglalagay tayo ng mga test results sa logbook. Okay? Ang dami-daming sinusulat. Physical facilities and the work environment. So, you read. So, dapat well ventilated, lighted, clean, and safe, at saka functional areas for the services. There shall be a policy guideline sa biosafety and security. So, dapat may procedure din on the proper disposal of waste and hazardous substances. So, what do you mean by this one? Referral of examination outside the clinical laboratory. In cases wherein the clinical laboratory cannot offer all of the following tests or some of the tests, it cannot offer some tests, okay, it can refer the samples to other clinical laboratory provided na meron silang memorandum of agreement. Like for example lang to in case na si Divine or si St. Paul cannot do a test because they do not offer this one, they can collect the sample and they can send it to other laboratory. Pwede nilang isend kay CBMC. Okay? Pero dapat yun, meron silang MOA, Memorandum of Agreement. Okay? License to operate. So, hindi siya transferable. Okay? Hindi pwedeng ma-transfer yung license to operate. Okay? So, the license is not valid for any premise, location other than that which is stipulated therein. So, kung ano nakalagay doon na location ng clinical laboratory, dapat yun yun. Okay, yun yung operational. Hindi mo, like for example, meron kang LTO, license to operate sa Tugigaraw, hindi mo pwedeng ilipat yun sa Solana. Okay? So, that is valid for 1 year. Pag mga LTO, 1 year. License to operate to, ha? So, pag mga non-hospital based, dapat meron itong mga information. Nakalagay yung mga information na yan sa license to operate. So, aside from that, it must be displayed at all times sa madaling makitang lugar sa lab. Okay? Pag mga hospital-based clinical laboratory shall be, so they are licensed as part of the hospital. Okay? So, the capability to perform HIV and drinking water analysis shall be specifically indicated sa license to operate. So, if a laboratory is capable ng HIV at saka sa drinking water analysis, dapat nakalagay yan sa LTO. So, the clinical laboratory and its satellite services within the same compound shall have one LTO. Okay, like for example, what do you mean by satellite laboratory? A laboratory that is under the supervision of the main laboratory. Okay? So, yun. As long as the satellite laboratory is within the premises, malapit lang din siya sa clinical laboratory wherein it doesn't need another license to operate. Okay? Pero kapag outside na siya ng premises ng central lab, kailangan niya mag-secure ng another license to operate. Pag mga mobile clinical laboratories naman mobile, ito yung mga gumagalaw, okay, na laboratory. Okay, so they can move from one place to another. Nakalagay sa van, container van, mga ganyan. So, they shall be licensed as part ng main laboratory. Okay, and shall be permitted to collect specimens only. So, for collection purposes lang, hindi sila nagte-test. It shall be allowed to operate as long as it only collects samples within 100 kilometer radius. Okay? Changes that would substantially affect the conditions ng lab shall be reported sa CHD within 2 weeks from the initial date. Like for example, may renovation, okay, may expansion, dapat nanonote or na-inform si CHD. So, the LTO may be revoked, suspended, modified in full or in part for any material false statement ng applicant. Okay? So, procedural guidelines. So, here, so you read this sa mga procedural guideline ng application or renewal for the LTO. Okay, so here you read, guys. So, nai-inspect yan before a license to operate is given or released. The clinical laboratory is inspected and they are monitored regularly. Okay? Si BHFS or si CHD director, yung mga representative na, they will monitor the clinical laboratory. Pag may mga violation, mag-i-issue sila ng notice of violation. Okay, so you read for the fees, yan. So, binabayaran niya sa DOH. Okay, we move to the violations. Kasi these are the most important topics under this law. One violation is refusal to participate in EQAP or EQUAS. Okay? So, dapat lahat ng clinical laboratory nagpa-participate sa EQUAS. Issuance of a report which is not in accordance with the documented procedure. Okay, iba yung reporting na ginagawa as compared sa documented procedure na na-approve. Okay, so permitting an authorized person to perform technical procedure. Like for example, you are allowing non-medical technologists to perform the test. Okay, hindi siya medtech, pero siya yung pinaggagawa mo ng lab procedures. Bawal yun. Incompetence or making consistent errors. So, this is a violation. Kapag always na, like in the case ng diba, yung case study nyo. If laging mali, namamali ng resulta, nagagawang positive, nagkakamali, due to negligence and malpractice, so violation yon. Deviation from the standard test procedures, okay, including the use of expired agent. Okay, so those are violations. But guys, later on, you will see some laboratories use expired reagents, provided that their test results are within the range for the quality control. But I do not say that that is okay. So, as per the law, bawal siya dapat. Of course, this one, reporting and release of erroneous results, mali-mali. Lending or using the name of the licensed clinical laboratory or the head, okay, to an unlicensed clinical laboratory, bawal yun. Like for example, si clinical laboratory A, they were able to secure a license to operate. Si clinical laboratory B, hindi siya nakapag-secure. So, ipapahiram sa B, bawal yun. Unauthorized use of the name and signature of pathologist to secure the LTO. So, this must be clarified to the medtech or to the pathologist that their signatures are needed or will be used for the application. Eto guys, some clinical laboratories to this one. Nagre-report sila ng test result without performing the test, especially pag mga fecalysis. Na hindi for consultation. Yung mga for, for application ng work. May mga laboratory gumagawa niyan. Hindi na nila tinetest. Bawal yun. Okay, performing and reporting tests in a specialty or subspecialty in which the laboratory is not licensed. Like for example, a laboratory, they are not capable of giving or offering HIV testing, pero ginagawa nila, or COVID testing, pero ginagawa nila. Bawal yun. Giving and receiving and commission, mga split fee arrangement, yan, for patients. Okay, so eto bawal din to. Yun, yung mga may bonus, commission, or kickback daw, bawal yun. So, investigation of complaints. So, the BHFS or CHD or representative nila, they will investigate the complaint. Okay? And then, they will have an investigation and determine kung isususpend, ika-cancel, or i-revoke. Pag isususpend, guys, this means that they cannot operate for a certain period of time. Okay? So, pag cancel or revoke, tatanggalin talaga yung lisensya. Okay? Yun yung pagkakaiba. So, ang penalties, kapag walang proper license and they are operating it, pwedeng imprisonment for 1 month and a fine of not less than 1,000 to 5,000. Depende sa korte. If they want to appeal naman dun sa decision, like for example, ang decision ng BHFS or CHT is to revoke the license, the laboratory can appeal naman to the Office of the Health Secretary within 10 days after the receipt of the notice of the decision. So, pwede silang mag-appeal sa Health Secretary. So, thereupon, the BHFS shall promptly certify and file a copy of the decision, including all documents and transcript of the hearing. Okay, to the Office of the Health Secretary para ma-review. So, we have the repealing clause, the parability clause, and the effectivity. So, there are also pertinent laws, guys. So, here yung mga pertinent laws. So, you read and understand. Okay. So, like this one, EO number 2007. So, we are headed by pathologists. Okay, sa RA 4688 naman, it provides the basis of operating and maintaining a clinical laboratory in the Philippines. Sorry yung spelling. Sa AO number 2001, 1973, this is about the, so yung goal nito or objective is to govern, okay, or purpose of governing the rules and resolutions on registration, operation, and maintenance ng mga clinical laboratory. Sa AO na number 290, series of 1976. So, itong mga ito na-amend, mga amendment. Okay, requirements for clinical laboratory, as well as provisions sa pathologist. Okay, so here guys, under this law, a pathologist may be authorized to manage and supervise of not more than 3 clinical laboratory. Hindi dapat lalagpas sa 3 clinical laboratory and or blood banks. Okay? So, sa localities naman or sa places wherein walang qualified pathologist, okay lang din ang physician. Okay? Pwede silang mag-head ng only 1 clinical laboratory provided na meron silang training sa laboratory, sa clinical laboratory. Sa Order number 48 series of 2001, ito yung nagka-classify ng clinical laboratory based on institutional character kung hospital or non-hospital based. Also, yung differentiation ng institution-based and freestanding. Sa Administrative Order 2007-207A naman, it exempted the National Tuberculosis Reference Lab and Regional TB Reference Laboratories from performing, this should be guys, TB ha, hindi TB, TB culture, and they do not need to secure a license to operate. Okay? So, hindi na nila kailangan kumuha ng license to operate. So, provided that they have adhered to the program policies ng international standards. Sa Department Memorandum Number 2009 naman, it prescribed the R&R for the implementation of internal and external quality control program, as well as the EQAP. Okay? So, they need to participate sa ECWAS in the National External Assessment Program. So, lahat daw ng clinical laboratory dapat may internal and external quality control program. So, kasama siya sa licensing, yung internal and external. Si Department Memo Order 2009-0086A, yon dapat may NECWAS. Okay? So, same lang din, pero this is A. So, they need to participate in the NECWAS. National External Quality Assessment Scheme. Yun yung NECWAS. Administrative Order 274 series of 1976. So, this one, to give adequate laboratory support to clinicians in the diagnosis and therapy of patients and to help detect pathological changes prior to the manifestation ng signs and symptoms. Sa AO 118B, series of 1992, it prescribes rules and regulation for the accreditation ng clinical laboratory as teaching and training grounds. The Department of Health through the Bureau of Research and Laboratory is empowered to monitor and improve the accreditation of clinical laboratory for medical technology interns. Okay? So, kailangang may ito is accreditation sa mga training and teaching hospitals or laboratory. Kung pwedeng mag-intern doon ang mga medtech students. And last, the CHED Memo Order number 6, series of 008. It extends the expiration of accreditation in clinical laboratory. So, in whose permit set in 2007 and 2008. So, ito yung extension. Okay, sa mga clinical laboratory. So, this was year 2007 and 2008 naman. Okay, so that ends our discussion for this topic. Guys, please review for your exam. Thank you for listening and God bless. Again ha, do not forget yung service capabilities ng primary, secondary, and tertiary. Lahat ng test na ina-offer ni primary and secondary, pwedeng i-offer ni tertiary. Pero kapag primary lang, yung mga test lang ng primary. Pag secondary naman, hindi niya pwedeng i-offer yung mga service capability na test sa tertiary. Yung mga under ng secondary and primary lang, ha? Okay, so thank you guys.